Fran Melmed is the owner of Context Communication Consulting, an award-winning HR communication consulting firm that specializes in worksite wellness and healthcare consumerism. She has worked for St. Gibbon, North America, Hewitt Associates, IMS Health, Rome, ROHM, and Hess, and IKEA, among others. She and her clients have received recognition for their work from the Society of New Communication Research, the National Business Group on Health, Marcan, CDHC Solutions, and the Philadelphia Business Journal. Fran is a co-founder of CoHealth, a virtual community focused on workplace wellness innovation, and writes a blog on workplace wellness, free-range communication. She is also a popular speaker, recently being named the Luminary Labs 50 Most Mind-Blowing Proactive Health Keynote Speakers. And then there's a
now
big
I need to be mind-blowing.
What did I say? I said mind-blowing.
No, that's right. I said, now I need to be mind-blowing.
Oh, okay. I thought I said it wrong. Okay. Anyway, that's the Reader's Digest condensed version, and if you don't know what that is, you're much younger than me. So thanks so much for being here, Fran.
Thanks a lot for having me. I appreciate it. And thanks for everybody who's on the line and listening today. I'm hoping you're seeing my landing slide, which is the Let's Get Beyond Physical title slide.
Yep, you're good.
I plan to talk today about trends, reactions, strategies, and tactics to improve workplace wellness. I'm going to largely focus on communication and change management, but because I believe that everything communicates, I'm also going to touch on organization effectiveness and culture and policy too. So I know that Michael, I just told you a little bit about me, but I want to cover a few more things about the work I do with clients and elsewhere. I formed Context 9 years ago after working at Hewitt Associates, which is now Aon Hewitt, a management consulting firm that specializes in human resources, and also a bank. In the bank, I worked in human resources and corporate communication, and in Hewitt, I worked in communication and talent and organizational change, or org effectiveness. So my approach is colored by these experiences. I focus on communication and change management strategies with my clients, a few of whom are featured here. I've worked with these clients to help them introduce new benefit plan types like high deductible health plans, to assess the breadth and depth and effectiveness of their current wellness communication strategy, and to build, implement, and measure long-term strategies for creating a culture of health. Throughout these slides, you'll see a few examples from a client that I help support the conversation that we're having. And I'll also bring in stories from other companies as well. So like many of you, my clients are responding to current trends, such as the unceasing rise of healthcare costs that are hitting employers and employees and their families. As you see here, employers pay 36% more for healthcare than they did just 5 years ago, and employees contribute more than 45% more over the same period. And this is according to the 16th annual Towers Watson and National Business Group on Health Employer Survey on Purchasing Value in Healthcare. So in response to this, employers have identified a few key strategies that they're going to put into effect for 2012. They're going to do a little bit more cost shifting. They're going to try new plan types, such as the high deductible health plan, either launching one or doing a full replacement, which means that's the only plan type that they'll offer. They will revamp their incentive design, adopt value-based benefit design, and expand wellness program eligibility to family. And employees have also adopted their own belt-tightening strategies, but their strategies look a little different. They're more likely to postpone or not get health care services or skimp on prescription drugs. So while two of the top strategies for employers today are to develop or expand healthy lifestyle activities and their use of incentives to encourage these, employers are also increasingly turning to outcome-based incentives or penalties to motivate employees. That's because the biggest barrier to their maintaining affordable benefit coverage, according again to this Towers Watson and National Business Group on Health survey, they say that their biggest barrier is employees' poor health habits. And engaging employees to change those habits has proven to be truly difficult, as I'm sure you're all aware. When you think about it from the employee side, which as a communication consultant, that's really, we need to put ourselves in the seat of both the employer and the employee. So when we shift over to the employee seat and think about them and they're bearing more cost and they're coping with stuck wages, dealing with greater productivity expectations but fewer teammates, this can feel like shift and blame. Shift the cost and they take the blame. And so we hear things like this when we eavesdrop on people talking about workplace wellness. I still hate them. Wellness sucks. I'm a wellness program hater, and things along of that ilk. And really, let's be honest, there's plenty to deride about some major disconnects in workplace wellness. A SHRM 2011 report on HR trends mentioned HR concerns that were keeping them up at night. They were an aging workforce or undetected and untreated mental conditions and safety in the workplace. The respondents to this survey recognized the stress their workers were feeling at the same time as they noted an expectation that employees would respond to email 24/7. Those disconnects are not unusual. And they're why I titled this talk, Let's Get Beyond Physical, because to be effective, workplace wellness needs to dig a little bit deeper and use all the levers available to close the gaps and to support and help sustain healthy choices. So for the rest of the presentation, what I really want to talk about are the 7 levers of workplace wellness as I see it, and to share some examples and ideas for using them. So let's start with number 1, which is personal. When we consider what employees need in order to make healthy changes and how we can help, we really, really need to start with the personal. And we need to consider the fact that there are many layers of personal and to look at it from all angles. The most obvious layer of personal is life stages, where we are. You know, we can be single, married, children, taking care of an adult, aging adult. And even though we may, depending on the industry or the geography, stay with companies for a shorter period of time than we may have in years past, we do move through many of these stages while we're with our employer, and our needs differ with each. If you think about yourself and you think about your need for health care, other health services, your need for work-life flexibility, you'll note that it's changed over time with each of these different stages. So the smart companies, they get this. They get that they need to customize communications, programs, and services to meet the changing needs of their workforce. So here you're looking at a summary of Deloitte's Mass Career Customization Model. They're just one of the firms that recognizes that when they flex with individuals, they retain talent, and they reduce the stress load on them at the same time. And the trust and appreciation that they build doing so endures and repays itself with higher levels of engagement and productivity. So the questions that I see that we need to ask ourselves are we bringing our work-life strategy into our wellness strategy? Or does it live a separate life? Or even more simply, are we considering that employees have families? Only recently are more companies starting to include families in their health communication strategy and addressing communications to them. Only recently are companies including spouses and children in a lot of the eligibility for wellness programs or incentives. So how are you reaching families? Do your communications go to home? Is your health information easily accessible on the internet so that spouses and others can access it? Do you write or direct anything specific to the family? For example, I'm working with a client right now on a strategy to create a benefits newsletter that's specifically written to kids about their interests, and we're even going to include kids as writers, because this client knows that the whole family's health improves with those reach out to kids. Another way to ask this question is to ask, are you telling employees their story? So if you think about your experience with Amazon or Pandora, for example, both of these companies, they really get to know us. They mine our data, they figure out how to guide us to what we want, and they want us to buy. And so how often do you see corporate communications that are tailored to you and tell your story in that same way, that make sure that you don't miss something that's important or of interest to you? The example that you're looking from here is from Thomson Reuters, and it's a product that doesn't exist anymore, but I like it because it shows how we can create attention-grabbing and valuable communications by mining the data that we already have. In this case, it's a personalized reminder to get a preventive screening test that's based on a person's age, gender, and some other demographics. You can see that it's titled to Bruce. That includes, they know that he's an African-American male and that he's married and has kids. And it's all tailored so that when Bruce picks it up, it already connects with him. In other cases, another way to tell employees their stories is to recommend available wellness services based on claims or health risk assessment answers. So to use your data and to customize the response so that it is personalized and customized and directing an employee to the things that they need. It doesn't really need to be so complex. I realize that doing that can be difficult. It takes a lot of time. It takes the technology. It takes the budget. So you can start by creating targeted communications like the kid-focused benefits newsletter, or creating campaigns that are targeted at specific audiences you need to reach. I'm also working with a client, for example, to create a campaign to increase the percentage of men 50 years old and older to get preventive screenings. We know that men don't get preventive screenings, and so in this particular client's case, they're no different, and we're going to create a campaign that reaches out to them, that tells their story by focusing only on them and the messages that they will relate to. And we will include them in the creation of those materials so that we know that we hit it. Another way to deal with the personal is to recognize that there's a difference in the way that people who are in good health and those who are in fair or worse health act. In a study on employee perspectives on healthcare, Towers-Watson found that those in good health believe they have the ability to change their health status and have taken actions to do so. And they also feel it's a priority. That's different for those in fair or worse health. They're less likely to use your programs. And this is repeated also by some Edelman health information where they segment people into groups that they call activists or apathetics and so forth, which is useful for us because when we know that there are people who are in fair or worse health and feel disempowered, we need to help make them feel less so. We need to influence the people who feel helpless. We need to use the people who are activists to make them feel less so. So one way to do that is with peer-to-peer interaction, using the person like me or regular employee who is somebody that we most readily trust, according to the most recent Edelman Trust Barometer. So here you can see an example from a client I worked with to build an impressive wellness champion program. They have 500 or over 500 now wellness champions nationwide that cover, this is Saint-Gobain. So it covers their manufacturing facility, which has over 200 locations, multiple shifts, and we have coverage in almost every location and many of those shifts. This is a page from the recruiting campaign materials that we use as one of our first tactics to reach out to them and to use them and to find the people who had made a change, who were proud, who felt powerful, and to recruit them to help others move in that direction and feel that way. So a second lever is social in real life and virtually. The way that I see it, there are 5 major reasons to take employee wellness social. First, it's where we're spending our time. I don't know about you, but I'm on Facebook more often than I should be. Second, we know that we're influenced by our social networks. Books like Connected show us the power of these social connections. The third reason is that we can engage people in their health through their interests. If you think about using social networks around hobbies like running or health concerns like aging parents, we can grab them there and help guide them to information that is viable and useful to them based on their needs and their interests. We can also connect them to these trusted peers that I'd mentioned, whether that's other employees who can recommend or explain a health plan, or an external community if there is reason to bring it outside. So for instance, perhaps a health condition. There are organizations like Patients Like Me or Cured Together that are focused very, very specifically on conditions that may not be prevalent in your organization, but your people could still benefit from knowing about it and getting help and connecting with people who are going through similar circumstances as themselves. Excuse me. Finally, these online communities, they give us, you and me, a direct line to what people are confused or asking about, because they're a feedback loop to us. They're virtual eavesdropping. When we have a blog where people ask questions or share comments, or we're on Facebook and they misguidedly tell somebody about how a health plan works, you get to hear that conversation. It's very different than the water cooler conversation that's going on that you're absent from. Here you get to hear about it. You can correct those misunderstandings immediately. So social also offers employers a way to be this connector for employees in a casual and inviting way. And here, again, I'm using Saint-Gobain as an example to talk about. I mentioned before that they started offline with a volunteer wellness champion program. From there, they went online to start with using some social tools. And the first one that we built was a forum for these champions, because they were spread nationwide. But they knew better than anybody else what these champions were dealing with in terms of trying to help employees get online and use the computer, or to launch certain and support certain wellness challenges, or to explain the way the wellness incentive worked. So we created this forum so that they could share their struggles and advice, and we could learn from and with them as well. From there, we've grown our social media strategy, as you see here, to use other social tools like podcasts, blogs, Twitter, and most recently Facebook, to get information out to employees and to their families. Excuse me, I just want to take a drink of water. And we've done this also to let them talk with and hear from one another. For example, with their podcast, this has an open call-in period too, so that employees can call in and talk with employees or experts and get advice and unique to their situation. And I know that some of you are thinking, well, what if they ask a question that is inappropriate or is a privacy concern? Those can be handled by taking them offline, but at that point in time, you at least know what their concern is and can address it. Saint-Gobain also has a success story microsite. So if you are familiar with Shape and their success stories, or Weight Watchers and so forth, this success story microsite operates in much the same way. Employees share their personal health stories and what tools or programs they've used to be successful. And then we've organized it by health need or interest, and it allows for comments. So other employees can ask questions and seek advice. They can also vote on good stories so that you don't end up with the clutter that you sometimes see in forums. The good stories here rise to the top. So today, employers also have an increased array of companies to partner with to make healthy behavior fun and social. I have a few pictured here, companies like Shape Up, Kiosk, Limeade, Red Brick Elf. They all offer regular and varied and tailored individual and company challenges to keep people interested in eating better or increasing their physical activity and making other healthy changes. And insurers are also getting on board with this. Humana, who's pictured here, up here, do you see my arrow? I think has a network called Humana Fit. And that's a network, a community network for members to track and share their workouts or meals. More recently, Aetna's jumped in with Mind Bloom, which is a game their members can use to make track and share goals of all sorts: relationships, finances, spirituality, and creativity. Together, these are working to provide increasingly community-based, customizable, and personal interventions that can keep people moving forward with small changes toward healthier lifestyles. Another way to hook or engage employees is through their interest in doing something good or something meaningful. Most companies, for example, provide an incentive to employees who complete a health risk assessment. Kaiser Permanente did too, but their incentive was a donation to this company here called Wholesome Wave, which is a program that improves the accessibility and affordability of healthy, locally grown foods. So through Kaiser Permanente's Take and Give initiative, for every employee who completed a health risk assessment, Kaiser gave $50 to feed a hungry child, and their participation shot through the roof. Now, I don't consult with them, so this is information that I found through public sources. But think about how different a message it is when you talk to employees about doing good for their own bodies while doing good for others, particularly kids or low-income families. I'm sure many of you struggle with incentive design and how to motivate people, and to motivate through extrinsic motivation or intrinsic motivation. The feeling good about doing good is something that we can sustain through intrinsic motivation. And so I think that this is a powerful example of engaging employees through that. Now, the third lever is mobile. As you all know, we're a mobile workforce. We are on the move constantly, and we rely on our mobile devices to make that possible. I like to say that the mobile phone is the ATM of health, and that it dispenses information and tools that helps us manage all aspects of our health and well-being. And as mobile health continues to explode, we're seeing that development of text-based health interventions and health apps, tools that help us eat better, increase our activity, prepare for a baby, or manage stress, are all on the rise. We're very much in the learning mode, but there's a lot out there to be aware of and to be mindful of. What you're seeing here is Hot Seat, which is a health app that I've built for employees to help employees with the quote-unquote sitting disease. There's been more articles recently about how our sedentary behavior, our many hours sitting while commuting and at work and then at home watching American Idol, is negatively affecting our health. So with Hot Seat, employees can unseat themselves with preset programmed activity alerts, and they can create social groups so that they can take these kind of small fitness breaks throughout the day and hold each other accountable. And they increase their energy and exercise minutes without decreasing productivity. Excuse me. So many of you are probably working with partners who have mobile tools. Your insurers, perhaps your wellness partners. And I'd encourage you to consider this soon-to-be indispensable channel when you're developing your health communication strategy. It's likely that you're already giving certain segments of your workforce a smartphone or a tablet. It's even more likely that they own these themselves. And what I'd like to ask is, are you leveraging them? Do you know how many of your employees own these devices? Do you have a mobile optimized version, for instance, of your health information so it's easy to get the information that somebody needs while they're on the road or at the doctor's? I wanted to ask, have you created any tablet or smartphone tools or text interventions, or do you share direct-to-consumer ones with your employees? In a benefits newsletter that I write for a client, we regularly run a feature that's called On the Road that talks about different health apps that employees write in about and share which ones they like and why they like them and how they use them. And this is just one way to also support employees' adoption of these tools without necessarily building or buying your own. Tracking data is also another growing trend that I'd encourage you to pay attention to and incorporate as part of your health strategy and health promotion strategy. There are sensors and devices like Green Goose. Nike Fuel Band just launched a week or so ago, and then the Fitbit, which is a powerful pedometer, which I actually wear daily. All of these track activity or eating and sleeping habits, or the Green Goose tracks even, some of their sensors track such simple activities as brushing your teeth. And now the idea of tracking all of our little bits and movements is foreign to many of us today, but we're going to see that more and more people start to use these devices to understand our own behavior, to change our own behavior, because with that information we can understand our habits and then we can change them and adapt them. This quote from Susanna Fox, who is at Pew, is one that demonstrates the power of putting information into people's hands. She says that once someone has a mobile device, they're more likely to use the internet to gather information, share what they find, and create new content. It forever changes the way employees engage with and think about their own health. And when these devices come from you, so for instance, the Fitbit is a device that now integrates with Limeade and Shape Up, and I'm sure we'll be seeing more companies and more insurers doing these types of partnerings to allow you to provide these devices to your employees, or if they already own them, for them to use them as part of your walking challenge and so forth. When these devices come from or work with your programs, they give you vital information about the health of your workforce. Now the fourth lever is emotional. The American Psychological Association, I'm not sure if you've seen this, they just came out with their most recent Stress in America study. While some signs of stress are better, there's still a lot to be concerned about, particularly with our growing segment of employees that are adult caregivers. And that is a segment of the population that is on the rise. When we're stressed about something, whether it's work or finances, our aging parents, or our ill kids, we know that we don't perform as well. We're present, but we're not working optimally, or we're absent because we need to take care of our mother who needs to get to the hospital, or our kid who can't go to school. And we also can relapse to crutches that help us, like eating or drinking or smoking. So you probably offer an employee assistance program, and perhaps you offer other behavioral health services. Increasing understanding and use of these services, as well as influencing work-life flexibility within your organization, is critical to improving the emotional health of your company. And so I was really excited when I worked with a company to create this material. I worked with Cigna and a client to create this material, which is about Cigna's Integrated Personal Health Team Service, which is a service employees can use that includes a team that's focused on working with them, and that team can be pulled together from nutritionists, psychologists, social workers, nurses, and so forth, to help people, whatever their front-facing problem is. Let's say they call up for weight management, and whatever may be the real issue, such as stress or some other behavioral issues. And what we wanted to do here was remove some of the biases we have against insurers. And we wanted to focus on the people who they're actually talking to. So what you see here is you see Heidi. And we intentionally talked about, who is Heidi? Where is she from? What is she like? What are her hobbies? And what would it be like to work with her? And in that way, we used communications like this, including, this is a brochure, but there's also online video content where people can watch more about Heidi and other coaches, to humanize this service and to feel like you could be calling somebody that you would feel comfortable speaking with. And because this brochure also featured employees who had successfully worked with coaches over time to share their story, we got both sides of the relationship. The fifth lever is financial, and this is, of course, very much tied to emotional health. I want to show you some data from the Stress in America study. I'm not sure how legible this is. This is the only statistic slide I decided to throw in here because I was worried about legibility. But you can see what are the causes of stress: money, work, the economy, relationships, family responsibilities, and so on. There's really nothing terribly surprising here. But what there is here, particularly if you could gather this information on your own workforce, is what we need to tackle with our communications. So going back to some of the questions that I ask myself, or I suggest you ask yourself, is, are you including financial well-being under your wellness umbrella? Money is the top concern for people. The economy is third. Clearly, we know that people are not ready for retirement. If we go back to what I said in the very beginning, that people are skimping on health care, they're cutting out prescriptions. We know that they're not engaging in the activities and the behaviors that we want to see because there are these barriers. So when you use data such as this to inform your strategy, you'll make sure that you're tackling the issues that are getting in the way of employees being able to make the healthy changes that you want and they want. The sixth lever is environmental. So if making healthy choices was easy, I think we'd all be doing it. The fact is that it's just not. We're fighting against our ingrained habits, our limited or incorrect information, impressive marketing campaigns, food pricing policies, and so much more. So when I started, I was talking about how everything communicates. And to me, the environment in which we work with is very much something that communicates where we are in terms of a culture of health. Does it support or does it get in the way of people being healthy and making healthy choices? If you think about how naturally we do this for other business strategies like sustainability, it may kind of awaken us to the fact that we could do so much more in health. So IKEA, when I went to the corporate headquarters at IKEA, I was struck by a couple of things. We all know that they're very interested in sustainability and price containment. Well, and they're very good with family. Anybody who's gone to their stores knows that they're excellent with taking care of families. They do the same thing at their corporate office. If you come in a Prius or another hybrid, you can park right up front. If you are carpooling, you can park right up front. As you come into their office, I have no idea where the elevator is. I have never seen it because the first thing that's there is a central staircase that as you climb it, because the HR is up on the top floor, it gives you little motivational messages on the top riser as you hit each next floor to keep you going, including applause at the end. And now, of course, not every company can have a central staircase. We don't have the choice of going and building a brand spanking new office environment. But what we can do is use signage and open bright design to increase the use of stairs. We can do things like use the red, yellow, and green or traffic light symbols to direct vending machine and cafeteria choices if you can't change those options altogether. Or one of my favorite stories is going all out Zappo style. They created an indoor park course. Now, most of us, we don't work in environments where we can create an indoor park course. This was truly unique to them. But they worked with their employees to understand what would be fun, what would get them up and moving throughout the day, what would remove some of the stress that they're feeling, and particularly at the call center for being on the phones. And they have humor stations, and they have like a simulated cutting down a tree station and so forth. So with a little bit of time spent with your employees understanding the hiccups and the things that can be created to get beyond those, we can all create an environment that nudges healthy behaviors. So the last lever is the political lever. To me, and increasingly we can see there is a zeitgeist of health going on. Hotels are now making sure that you can rent yoga mats or bicycles or take yoga. We're choosing where we buy based on what kind of health support that they provide. We want people to affect our world. So when we talk about it from a health perspective, there's the healthcare reform discussion, obviously. But there's also other ways that we can have an effect on things like the growth of childhood obesity. So for instance, in Louisville, Ships, a healthcare company, and I believe there's a representative on the line today from the company, they created something called Farm to Table, which connected farmers from Kentucky with restaurants, schools, workplaces, and just individuals in Louisville. And they bring it into their own workplace so that their employees can benefit from this Farm to Table program. This improves the whole health of the entire community, and it improves the health of their employees and their covered dependents. And according to the Edelman Health Barometer, which is a study about our attitudes toward health and the organizations and government bodies that are involved in our health, and it also digs into devices and motivations and social supports and so forth. They found that the external world is watching what we as companies are doing or not doing around health. And we are increasingly making purchasing, applying, and even recommending decisions based on our investment in our employees' health, but the public's health as well. That's that growing zeitgeist around health. We're more likely to buy, apply, and recommend if we feel like not only are you taking care, a company's taking care of their employees, but they're taking care of their community as well. To me, that's not an ROI that's not typically accounted for when we talk about how wellness delivers ROI. There's the often quoted 3-to-1 return on investment, or that companies with effective wellness programs report that employees are 8 times more engaged. But this is a different ROI. This is an external ROI that also works on our employees. If you're talking about employee brand and employee value proposition, this translates into how we perceive our employer and how we perceive the businesses in our community and the businesses with whom we do business or want to work for. So like I said earlier, everything communicates, and how we make decisions about the type of employer we're going to be is another thing that communicates, that we can address through the way that we go about creating this culture of health and the richness and the expanse of how we consider that, and whether or not we get beyond the physical, nutrition, tobacco cessation, stress management, and general health promotion that makes up the majority of wellness efforts today, and we expand out to think about work-life flexibility, financial well-being, spiritual well-being, and mental well-being as well in the same way. So I think that I have worked through a lot of information in a short time. I find that that's one of the difficulties of these discussions, to be able to leave time for questions. We also want to get through our material. And so I will open up for questions in a few minutes, but what I wanted to really close with is 2 invitations. I want to invite you to look at this as a conversation starter, and that if you are interested in exploring these topics more, that you join CoHealth, which Michaela had mentioned in the beginning. That's a virtual community that I co-founded that talks once a month on Twitter and also more regularly and ongoing on LinkedIn about strategies, about resources, about research, and tries to collaborate on improving their interventions, both design and communication strategy where they work. And you can find information on my website. And I also want to invite you to participate in a study or a survey to understand employers' perceptions and the use of technology, some of the technology that I talked about here, health apps, text-based messaging, interventions, tracking devices, and even email, teleconferences, and so forth. I'm doing this survey with ShapeUp, which is an online wellness solution, and we would like to invite all of you to participate so that you can get a report on our findings. What I would plan to do is to opt you into the survey with the spreadsheet that Michaela gave me, and that if you would like to opt out, you can either opt out in advance by emailing me or opt out by not responding. But we would like to track over time this changing evolution and use of technology, because we see what's happening in the healthcare space and how that is influencing, and in the direct-to-consumer space, and we see how it's influencing people's behaviors. We see how it's helping support people who want to quit tobacco, or to improve health coaching programs, and how these different types of campaigns and devices are making a sizable difference in our ability to help people sustain behavior change. So with that, I just point you to my contact information and invite you to get in touch with me any way you would like, and to turn it over to any specific questions that people have about what I said or something I didn't say.
Great. Maybe she raised her hand accidentally, who knows. Let's see, Fran, with more employees becoming telecommuters, what are your thoughts on how we can reach them?
Well, I think that's really one of the reasons why it's so important for us to have information that is available on the internet, that's easily accessible to them wherever they go, because we are mobile, because we're working from home, or we're working from Panera Bread, or we're working from our car, that it's going to be increasingly important for us to have communications that are as mobile as they are. So I would start by gathering data about, the technology adoption of your workforce. How many do have smartphones or tablets or other ways, at-home access, so that you understand how they're getting on to the internet, or how they're accessing your information. And I know that many people say that, well, we have people who are technicians. So for instance, I was talking with Comcast last week, and they of course have a lot of technicians. And we were talking about their use of technology for their jobs. Well, is that a channel that they're already using that you can tap into to get your information out to them? It's just that you have to build the communication for the channel that they're using most readily. But you can't do that without first understanding what they're using to do their jobs or at home.
Super. Okay, let's see, more questions. What results can you direct us to regarding mobile and text messaging apps?
What results?
Results, yes.
One of the places that I love to go for information, and they're actually having a webinar on 2012 trends coming up, I can't remember the exact date right now, unfortunately, is Mobi Health News. It's M-O-B-I Health News, and they write routinely about adoption, about effectiveness, about what's going on in the employer space as well as the direct-to-consumer space. It's a very, very rich resource for understanding and getting more familiar and up to speed with this, this growing trend. In terms of effectiveness, with health apps, I think everybody would say that there's a lot of downloading going on, there's not a lot of using going on, and that is something that we need to watch and see how it changes. With text-based messaging interventions, there are many good stories that support that kind of intervention has helped people who have tried to quit tobacco quit for longer, or that there's a program called Text for Baby that helps mothers prepare for their prepare during their pregnancy and even after their pregnancy for the health of their baby, and other such programs, particularly in developing countries where this is a cheaper but highly adopted technology, where we have good research from them about what can work.
Super. Let's see. Fran, any more ideas on how to reach the family from Sabrina?
Okay. Reaching the family, I think that at its most basic, the two most basic ways, or three, would be, four, sorry. One is eligibility, I'll just keep on adding. Eligibility, obviously, you know, it's kind of shocking that dependents make up a huge part of most employers' budgets, and yet they have not been eligible for many of the specific wellness programs and resources. They haven't necessarily been part of the incentive design, and more companies are starting to go there. So eligibility and part of the incentive design is one. Inviting them to participate in certain things, whether it's you know, not just challenges, but in terms of coming in for, if you hold face-to-face meetings still for annual enrollment, inviting them in and making sure that they can be a part of it, because a lot of times, I don't know about your companies, my clients, it's the spouse who's making decisions. It's not always the employee. So you need to get the information to the decider, to the decision maker. Along that line, going back to getting information on the internet, so that it's not down on the, it's not on your intranet where they can't get it, nor is it locked down behind many passwords. Most of your health information is not a privacy concern. The password protection should come at the point in time where you're getting to somebody's personal information, not what benefits you provide or what health resources you have or where you're guiding them for specific health information. And then I forgot my fourth. That's what happens when you have too many, right? We can only remember a few things.
Well, you know, you can call me back later.
Okay.
Let's see. I was going to ask a similar question to Katie, I think it is. Can you quickly list the 7 layers that you went through during the presentation? And how did you come up with those? Is that something you sort of use as an ongoing framework, or?
Yeah, that's my framework. Let's see if I can go back to it. It's my framework, so that, because I believe that it is a more robust way of looking at wellness, and it includes both the environment and the cultures that we work in, the tools that we have at our disposal, the influence that we can have, and the way that we view the world.
Great. All righty. Wow, lots of questions. Hold on one sec. Okay. Family wellness. This is Bill McPeck. Hi, Bill. Family wellness. Judd Allen from Vermont has a couple of books that are quick reads that address engaging families in wellness. Do you know Judd, Fran?
I'm sorry, what?
You know Judd Allen?
No, I don't.
Oh. Bill was just suggesting that he has a couple of books that...
That's great. Yeah, thanks for the tip.
Family wellness, yeah. Here is a question from John. Is the Hot Seat app that you created available on the App Store? Was it something... And actually I have a follow-up. How did you make it? Did you use one of the nice little app tools online, or did you really...
No, I hired somebody. Oh. I'm not that good. I'm not that good. Sorry. Well, yeah. No. I came up with the idea, and I worked with somebody who could help me realize it. And it is not yet on the App Store. I'm considering putting it on the App Store so individuals can use it. Right now, it's designed for employers or health partners to buy, that they can brand it and that they can integrate it with their own wellness design program, so that people could, if, for instance, somebody has a points system, that they could get points for the activity that they're building up throughout the day. That can also be customized to activities that an employer may feel most comfortable with, because depending on where you work, there may be certain things that you wouldn't want to include in the available library of activities that it includes.
All right. Cynthia wants to know.
Oh, can I just add, people can sign up on my website under products to be notified as soon as that is available.
Great. Let's see. Cindy wants to know, what are your findings? What are you finding in companies regarding their activities in improving health literacy of their own workers, which is critically important in communicating and understandable health information?
Yeah, no, that's a really good question because, I don't know how many of you watched the State of the Union speech or saw any of the follow-up that called the speech written at an 8th grade level as simplistic. And the point is that it's not simplistic, it's simple. And simple is very different and very good. And the same type of framework needs to be taken for all the information that we provide employees around health, because health and healthcare is anything but simplistic. I just picked up this healthcare reform comic book that's been written by a professor of economics at MIT, and he's trying to explain healthcare as a comic book to make it a much easier to understand issue. So with my clients, what we try to do is to increase literacy and computer literacy a number of ways. One is the simplest of just writing with real language that people use and not the buzzwords that consultants like to use or experts will sometimes use from their jargon based on their industry. Another is to go out and talk to employees to understand where they're struggling, what are their issues, what are their concerns, what are their needs, and to build interventions and responses and communications that address those. And then I have with clients who have computer literacy issues, but yet want everything to be an online experience, self-service experience, built kiosk cards that are very visually based to be able to help employees understand, what do I do with this mouse, and what do you mean use the back navigation and so forth. So really make that painstakingly clear to people. We've also held classes, put together online tutorials to help people, and looked at other interventions to try and increase that, because I think that that's a real disconnect for people as we move to more online self-service. We're relying on people to do their own catch-up, and that can be hard. That can be very hard, and that can be self-defeating.
Absolutely. Okay, Jessica is wondering if you could share any success stories of organizations or companies who have successfully implemented a policy for paid time off for wellness-related activities. For example, paid time for a walking group during the workday.
Well, I don't know about people. I mean, yes, there's flexibility around that. Yes, I think that that's important. Now, I was thinking more of paid time off as in days off, and I do know Union Bank and Trust included paid time off as something that people could earn through doing their wellness activities, and I thought that was great. A lot of companies don't want to do that because they find that to be too difficult to administer, or they actually just don't want you to have time off.
Mm-hmm. Yeah, it's
and that's one of the reasons why with the 7 levers I'm talking about looking for disconnects, because if you go back to that SHRM study that talked about HR acknowledging that, wow, our people are stressed, we're worried about safety in the workforce, we're worried about mental conditions going undetected and what ramifications that have, but could you, at 3 a.m. respond to my urgent email? That these are the disconnects that make it a challenge to engage employees. It's not only that they see through the disconnect and wonder what it is that you really want, but they also find it challenging, as was pointed out, to get the time to go to the gym and to do something non-physically related, but certainly rewarding from a mental perspective. And we were talking about this before the session began. Be with our kids, right? Go to a ball game or go skiing and so forth. The things that balance out our lives and make it possible to work at the intensity that most of us are working at.
Yeah. Well said. Let's see. Don Ardell, I tried to get him to, he has a question. I was hoping maybe. Oh, Beth Ann. Nope, got you. Sorry. Don Ardell has a question. I was going to put him in the hot seat. Let's see if he balks. What do you think, Don? No? All right. Well, it's not often that Don Ardell doesn't have something to say. I can't help sharing that I'm a little shocked. Okay, here's another question from Beth Ann, then I'll get to Don's question. The Army has a policy of 3 hours per week for health and fitness activities for 6 months during the work week. For 6 months during the work week. That's interesting.
So 3 hours of activity during the work week for 6 months?
Yeah, I guess that's what she's saying.
Mm-hmm.
Oh, Don said he tried to speak and I muted him again. Sorry, Don, I would never do that intentionally. Are you there? Don? I'm going to leave it open and see if maybe we can get that. Alyssa, have you found any involving employees and program design that help facilitate buy-in? Does bottom line seem to work better does bottom up seem to work better than top down?
Yeah, I think it's important to have both, right? Because you need the leadership support to finance it, to keep it budgeted, a budgeted line item, to emulate it, to support the policies that would allow the paid time off or the work-life flexibility that makes this sustainable. But you also need to know what employees need help with, what they value. Talking about this 3 hours per week fitness activity, there's often discussion about on-site gyms and whether or not to have one. Well, employees can help you determine whether or not that's viable, whether or not that's going to be used, or if they'd rather have it in another way. So certainly with my clients, we include employees through surveys and focus groups throughout the year. We also, I would recommend creating wellness councils that meet regularly that have employee representatives on it, so that when you're discussing strategic decisions, whether programmatically or for communication, that you're getting their viewpoint on what to consider.
Great. All right. We are basically out of time, but Don, I'm going to give you one more shot, and then I'm going to say now, and then I'm going to say, speak now or forever hold your peace, at least for the rest of the day.
Okay, this is my try.
Yay!
No kidding.
Ask away.
All right. Gee whiz. Wonderful seminar. Thank you.
Thank you.
What if a CEO or other top company official, such as the owner of a small business, has a wellness agenda, feels real passionate about ideas concerning quality of life? Do you think his involvement in a considerable way is likely to do more harm than good? How could a coach or other wellness advocate channel this person's passions to help the employees advance toward better lifestyles and more life satisfaction, particularly with regard to such matters as helping the employees to be more critical thinkers and make better use of reason and deal more effectively with superstitions and cults and new age fads?
Wow. Okay, so if I understand correctly, he has interest in quality of life, and you want to use this person most.
No. This is simply a hypothetical question.
Okay.
People may someday be with a company that has a passionate, involved CEO or influential, and this person wants to address areas that are usually avoided at the work site.
Oh, I see. You're saying he wants to address the superstitions and so forth.
Exactly.
Oh, okay. I didn't understand that. And how would you coach him out of that?
Not out of it, certainly not. That's the last thing I'd want anyone to do. But do you think there are guidelines? Maybe you'd want to put something like this at your website if you approve of it, to guide coaches, to guide wellness promoters in working with someone who's powerful and passionate and yet can be disruptive, so
Right.
that controversy areas might be successful.
Right, right. Yeah, I mean, I think that whether controversial or not controversial, oftentimes the leaders that we would like to see be visible champions, or even models as they're going through their own health struggles, whether that be work-life balance or being overweight or quitting tobacco or something, that they often do need support and guidance and hand-holding, and maybe even a ghostwriter to be able to get their thoughts out in a way that's clear and accessible and just doable given their busy schedules. So I would suggest that that's very personal and unique to that person and that strategy, but that from a broad brush perspective, I wouldn't send any leader out there without somebody who's coaching them and helping them and checking them and then measuring and gathering employee reaction to it.
Okay, thank you.
All right, well, now we've run over. Darn it, but it was worth it.
Well, thank you so much for having me.
Well, thank you so much for being here. It was great. I was trying to remember how you and I connected, and I think we connected on Twitter.
We did connect on Twitter. I'm always there, so if people in the audience are on Twitter or looking for an excuse to sign up, I put my Twitter handle here, and I definitely recommend it as a place to find like-minded people or people who are in kind of tangential or slightly overlapping fields, because it is a real avenue toward educating yourself and keeping on top of trends and research.
Super. Well, with that, I thank you again, and thanks everyone for being here, and hope to see you again soon. Have a good weekend.
Thanks again.
Bye.
Bye.